Thank you, everybody. That's quite the introduction, isn't it? A good psychologist. Wow. So what is the role of a psychologist in all of this? Because I think up to now we've heard a lot about all of the physical health outcomes with these kinds of surgeries and procedures, and I think you can't really dispute that. It's kind of obvious, really. But I guess I always get patients often look at me quite suspiciously when they come to sit with me because they've been to see everybody else and they come to the psychologist. What's she going to tell me? Is she going to tell me I'm not well enough to have this procedure? Is she going to tell me there's something wrong with me? And that's not the case at all. I think I see myself as a little bit of a troubleshooter as well as anything else. So what I often say to patients is, look, this once you kind of enter into the decision, I guess, to have these kinds of procedures, you set yourself on a bit of a roller coaster. And we need to make sure they're driving the roller coaster first and foremost. But I think they need an opportunity to sit and reflect on the process because it's pretty daunting. It is pretty daunting. I think sometimes we take it for granted and we kind of are a little bit desensitised to what our patients have to actually go through. But when they enter into this kind of an arrangement and this kind of a journey, it can be quite confronting. There's massive adjustments that they need to make and they need to have an opportunity to sit with someone and reflect on that. So often I'll sort of say to them, look, just sit and breathe for a minute. Let's just not talk for the first few minutes. Often if they've been to see several people in the one day, they come to me and they're exhausted. And that's okay. Look, it's complicated. We've heard, all evening about how complicated this issue is. And I guess the other thing to make clear is that the etiology is quite complex too. So patients don't come to us with obesity or weight issues just because of lifestyle factors. It's one issue, but it's certainly not the causal factor. And I think we need to really remember that. Just as the treatment is complex and multifaceted, so are the causal factors for this. And each patient's different. So we need to remember that. There is no single cause. And I think sometimes we need to be aware of, I guess, a lot of the media discourse around weight and I guess around obesity. There is a lot of belief out there in the wider community that people that suffer with obesity, it's simply because they don't have any willpower, or it's simply because, they eat too much, or they just don't have a really good lifestyle. And we've just got to remember that patients often come to us with those beliefs themselves. So we need to be mindful of that. There is an association between mental health and obesity, but it's bidirectional. So we need to be careful that we're not saying obesity causes these things or vice versa. It is bidirectional, and again, each patient's different. We don't really know. There are comorbidities with regard to depression, and if you can imagine these patients, by the time they come to us, they've had often a long history of struggling with their weight and failures. So they've lost weight, they've gained. They've lost weight, they've gained. That yo-yo dieting creates a real sense of pervasive failure with these patients, and you can understand that depression is obviously a very, very big thing. Having said that, there's lots of obese patients that are not depressed. And there's also lots of obese patients that don't have eating disorders, and we have to remember that. Binge eating disorder is a fairly common, if you compare to the general population with these guys, and that's fairly self-explanatory. And often there's emotional factors that contribute to that, and that's what my role as well is, to look at what those emotional factors are. I guess what we've got to be really careful about, and Shamani's already touched on this, is that if we start looking at those kinds of comorbidities, we need to be careful about stigma. And like I said, there's a lot of information out there in the media. We live in a very visual society. My background is in eating disorders, so I've worked at the other end of the spectrum for many, many years with patients suffering from anorexia and those kinds of disorders. So again, they experience that stigma as well, and obese patients absolutely experience it. And there is a lot of research that shows that they experience it from healthcare professionals, exactly, people like us. And I think sometimes we can forget that. There's been research overseas which actually shows that over 50% of primary care physicians have negative perceptions of obese patients. They spend less time with them and they tend to view them as non-compliant, as being kind of not having willpower and being lazy, that kind of thing. I'm not saying you guys do that, but there is some research to suggest that patients feel that when they come to see their healthcare practitioners. So there is research that shows that weight loss treatments are associated with weight-based stigma. That's not to say that they're a bad thing, and some patients need to lose weight. Simple. It's just that simple. So we can't avoid the issue either. I think we can be sensitive to it, but we can't avoid it. And I guess for these patients that we're talking about, we can't skirt around the issue and try and be overly polite and politically correct. We actually have to address this. But what we need to do is understand that the theoretical understanding of what causes and maintains obesity, like I said, rather than just viewing it as a lifestyle issue. So how does all this stigma in particular and this bias, how does it impact treatment? I guess, because we've understood now that there's no single cause of obesity, we have to understand that treatment must be multifaceted and multidisciplinary. We have to create a wraparound care system for these patients, and that's what we do quite well. We communicate about our patients. I think Tim and I both saw a patient today. She saw Shimani last week. There was a couple of issues that we flagged with her. She's having some mental health issues, a lot of work-related stress. She's gained weight, and as you can imagine, she's devastated about it. But there are some real concrete reasons why that's actually happened. And because Shimani and I had a chat with each other about her last week, I knew I was seeing her today. I already had the information. So by the time she came in, my half hour with her was a very productive half hour because I was briefed on exactly what the issues were. And the information that she gets from all of us in the team is consistent. She saw Tim as well. She was quite exhausted by the end of it all. But I think it was helpful for her because she walked away with some validation, I guess. I mean, one of the things I said to her was that you've gained weight, yes, but you can get back on the bandwagon tomorrow. It's not the end of the world, and there are concrete reasons why you've gained weight, and that's what we need to actually address. It has to be patient-driven. When I say that, I understand that for these patients, they need to have that physician driving and that system actually driving their care, but they actually need to be empowered. There's very, very little point in us driving all of this for them, and then by the time they reach the end of their 12-month program with us, they just go back to the old habits. So they need to actually be the instigators of change within themselves, and that's my role, is to help them internalise all of the messages that they get from the outside, from all of you guys, and help them internalise that so that they can actually start to take this on board and drive the roller coaster rather than feel like they're just a passenger in it. Good communication with the team, as I said, I think that's something we do really, really well. Even with our record keeping, we keep the same records, it's all on file. When I see a patient, I pull up their record, I know exactly what consultations they've had, I know exactly what advice they've been given by the dietitian, by the exercise physios, so I'm in a position where I have the information and I can actually facilitate that and I can actually support that, as opposed to them having to sort of tell me, the whole story again, which can be absolutely exhausting. And it allows for regular patient feedback. We like our patients to tell us what's working and what's not. So if something's not working, we need to address it, and we need to actually be flexible, and we need to actually respond to it rather than just keep going as usual. So what are the major speed bumps with these patients? Look, I think probably the obvious one that everyone in this room, I think, would probably be able to identify is motivation. So clearly after the first few weeks, particularly following a surgical procedure, often they can be incredibly motivated. And it's great to see them like that. It's fantastic. We buzz and vibe off that ourselves. It's great because their weight loss is quite significant. But I think obviously what happens with these patients is that when that sort of peters off, which is a natural thing, or if it's not as much as what they'd hoped for or expected, then their mood can often drop as well. So part of my job is to help them understand that, like any other emotion, motivation is transient. It's not going to last, and although you're motivated now, you mightn't be next week, but that's okay. We can work through that. What they need to do is show a commitment to the process and understand that that motivation is going to wax and wane, as will their mood, and we need to help them negotiate those hurdles. Like I said, expectations regarding weight loss. I guess patients need to understand, like Tim said, it's a bigger picture here. We can't just expect that week after week after week there's going to be linear progress and they're going to drop weight week after week after week. It simply won't happen that way, and each patient's different. So some will plateau early, some might even hit pause entirely, some might gain a little bit, and we want to make sure that that's not an indication for them that it's not worked or that they've failed again, because often they have that kind of perception about themselves anyway. Oh great, I've failed again. And we need to kind of support them through that. Lifestyle and mood triggers. So, I've got one patient, for example, who eats out all the time with her friends, and it's all very social, and she enjoys a glass of wine, and who doesn't? That's great. But what she has to understand is that there are certain lifestyle changes that she's actually going to need to make, and part of my role is to address that earlier rather than later, preferably before they even have surgery. I get them thinking about that. What's it going to be like when you kind of go home after your procedure? Sure, you're going to have some time off, or you're going to have to recover, then what? And they need to understand that they're going to have to make these long-term sustainable changes. Part of that's rewiring the neural pathways, which can take time. Like I said, some of these patients have had many years of habits when it comes to kind of dieting, restricting, that vicious cycle actually, feeling really good on a diet for the first few weeks, few months. Oh, it's great, I've lost weight. Uh-oh, I've broken a rule, I've gained weight, and then they just kind of feel like a failure again. there's often lots of, like I said, mood triggers for people overeating, things like stress, things like boredom, things like depression, loneliness. These are all mood triggers. And I think what we do find with this patient group is that more often than not, they're not very good at being able to manage distressing and negative emotions. They use food to manage that. And part of my role is to help them develop other coping strategies so that they're not using food. Challenging emotional avoidance, like I said, self-regulating distress, self-regulating anxiety, that kind of thing. Anxiety in this group is huge. As we know, when your cortisol levels are through the roof, very, very hard to drop weight, and it can lead to a whole host of other issues as well. So teaching patients how to actually relax, it's something sometimes we do take for granted, but these patients often aren't very good at it at all. And partly that's because they're not very good at self-care, which is in part because they don't really like themselves very much. So their body image and their sense of self and their self-esteem is often quite low. So to teach these patients how to actually nurture their bodies and look after themselves in and of itself is kind of quite foreign, and they need help to actually step through that. This is where self-belief comes in. Once they start making gains, if we set realistic goals for this patient group and they actually feel themselves starting to achieve them, what you start to see is that their self-belief returns, and this might be something they've not had for many, 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 many years. They've just been on this trajectory of just feeling like a failure all the time. So once they actually do start to make these little achievements, then their self-belief starts to come back, and that's when they start to sit in the driver's seat again, when they start to believe in themselves again, and they need a team around them to encourage them that this is possible. You can actually be the driver here, and this is something that you can do long term. I had another patient today, and she's not in the best state at the moment, and I said to her, you know what, you mightn't believe you can do this, but I do. I absolutely believe you can do it. And I think sometimes to have professionals around her that, and not just her but other patients, where we can pick up on their uncertainties and their lack of self-belief, and sometimes they need to hear it from us that, you know what, I know you're feeling like this at the moment, I get it, but you can actually do this. And if that's the final thing you say to them when they walk through the door, you'll be surprised at how much they can pick up on that and how much that might resonate down the track. The commitment to follow-up is big. It is big. It is exhausting. They have to attend a lot of appointments, and that's part of it. It's part of them making health a priority. And I guess for these patients too, life gets in the way. It gets in the way for all of us. But for them to actually keep health right up the top of their list and realise that, without health, what have we got? Then attending those appointments is about them learning to actually prioritise health and actually consider it as one of their top priorities. I guess a lot of the time, and this is relating to, I guess, the neural pathways, is that dichotomous thinking, that all or nothing thinking, which is quite common in this patient group as well. So you'll find that with the restrictive eating and the history of dieting comes that mentality of good food, bad food. This is either good food, or it's bad, or it's junk food, or it's healthy food. It's just not helpful. It's not helpful for patients I see with anorexia, and it's certainly not helpful for this patient group either. We have to encourage flexible eating practices with this group. And the worst thing we can do is say to them, you can never eat fast food, you can't drink alcohol, you can't do this, you can't do that. Because the minute they start to kind of internalise this rule-based system, we're setting them up to fail, because inevitably you're going to break a rule, and what happens then? You then start to feel like a failure, and they start to kind of, feel pretty crap about themselves again. So I think we've got to be aware of that, the messages that we give to our patients aren't based on that sort of overly restrictive diet kind of based. We're not about diets in our practice at all. We're about sustainable long-term change, which is very, very different. And like I said, in order to achieve that, these patients have to undergo some major lifestyle changes, and with that comes just adjustment and often grief. Believe it or not, there's a lot of grief and a lot of trauma with this group, so I think we've also got to be mindful that there has to be some support for that as well. What have I done? I've just gone way back. Next one. Speed bumps. So in terms of, for you guys seeing patients who are, obese, I think one of the main things to remember is that this group have had, more than likely they've had negative experiences with other health providers. May not have been a primary care physician, it may have been a psychologist, it may have been, who knows, it could have been anybody, but they're often sitting with you with their own narratives and their own story of weight. So I think we've got to be mindful of that. So even though we might have the best of intentions and that we don't have any weight bias and that we're trying to address things, if we get resistance, often it's not us. Often it's because they've had this history and they may have had some of those negative experiences. We have to recognise the complex etiology of obesity, and I think we need to kind of understand that it's not just lifestyle factors at all. There's a whole host of factors that come into this. We need to explore all causes of presenting problems, not just weight. We've seen tonight, we've heard presentations that sort of talk about it being the other way around, that we need to include weight. But the same goes the other way too. You know, if we've got an obese patient sitting in front of us, we need to explore all causes of what's going on for them and not just their weight. Like I said, these patients have tried repeatedly to lose weight, you know, so the worst thing you can say to someone in this sort of situation is, well, you just need to lose weight. You need to diet, you need to watch what you're eating. They've been there, done that, trust me, a million times before, and you're not telling them anything they don't already know. If anything, you're perpetuating that feeling of failure because they're looking at you thinking, done that, hasn't worked. Yep, I failed. We need to emphasise the importance of behaviour change. And I guess coming from an eating disorder background where weight is something that I don't like my patients overvaluing that, and I'm very passionate about that. It's not just about a number on the scales. We all know that our weight isn't one single number anyway. It fluctuates. It fluctuates. So if a patient's weighing themselves every day, it's not giving them reliable information really on what they're actually losing. And I think we need to kind of be careful with that we don't overvalue the number on the scales. It's important to this group. It absolutely is. We can't ignore it, but it's not the be-all and end-all. So their number one focus and their number one goal might be weight loss, and it might be looking at the number on the scales, but like I like to try with my patients to kind of look at other goals. You know, I had one today and she wants to start riding a bike again with her son. She's a long way from that at the moment, but it's a great goal for her to have, and we're setting a pathway for her to achieve that. Things like feeling fitter, feeling stronger, you know, having energy to run around with the kids, planning a holiday for next year and being able to, you know, get on a roller coaster. I know that sounds bizarre, but we've had that. So, you know, I think encouraging patients to not just focus on that number of on the scales, because when the number doesn't keep dropping and their mood drops, what else have they got? But if they've got other indicators that are showing them that they're on the right path, then the number on the scales is going to matter to them, but it's not going to kind of send them into a tailspin, which it absolutely can if that's all they're valuing. We need to offer concrete advice, not just you need to lose weight. That's not helpful. We need to offer something more concrete than that. You know, and as I said, it's not just about behaviour change, it's about lifestyle. And I think telling a patient to kind of join a gym, again, best of intentions, but if this patient doesn't like the gym, and most patients that are in this group don't, and that's because of their experiences. It's not because there's anything wrong with gyms, is there? Nothing wrong with gyms, but their experiences of being in a gym can be quite overwhelming. So they need to be supported through that. We need to acknowledge the difficulty of lifestyle change. It's not easy. These are patterns that these patients have developed over a number of years. So it's not just as simple as giving them a quick 1, 2, 3, 4, 5 and sending them on their way. It's very, very difficult, and they need to get their head around that. And sometimes it's about just creating little goals for them so they get that sense of achievement. So, you know, if their goal is, it's the same with weight loss. If your goal is to lose 20 kilos, you don't start with a goal of losing 20 kilos. You start with losing a goal of, well, let's just start with the first 5. Let's just start with there, and then we'll sort of see how you go from there. And part of that's about regular rewards. It's about trying to teach patients to nurture themselves and care for themselves. We also get patients that come in, or I've had them even in my other practice, where, you know, it's all about exercise, and I know I should be exercising, but their cortisol levels are through the roof. They're so stressed, and when they hear someone say, I want you to take 2 sessions of exercise out, and I want you to add 2 sessions of yoga and meditation in. I want you to go and get a massage. I want you to go and book in and get your hair done. Go and get a pedicure. These are the kinds of things that patients look at me like, what? But teaching them the basics around self-care and how to nurture themselves, and that it's okay to feel good. I think patients forget that feeling good, there's nothing wrong with that. In fact, it's really, really important so that you start to value yourself and your health. And I think we need to recognise that small weight loss can have significant gains. And I think, you know, Viraj mentioned that at the beginning. As little as a 3 kilo weight loss can have a huge, huge, huge impact on a patient's health, not just on their physical health, but also on their mental health. So I think we need to remember that. And that's all I've got to say. Thank you very much.